Well, good afternoon. I'm here with Dr. Ezike to provide an update on the current state of COVID-19 in Illinois. More than 20 million COVID-19 vaccines have now been administered to Illinois residents. That's the highest number and the highest percentage of residents who have gotten a shot among all Midwestern states. On top of that, nearly 80% of our eligible seniors have received a booster shot, along with nearly 55% of all of our eligible residents. And we are pushing that number higher every day. In fact, right now we are administering an average of 47,000 shots, first, second, and booster shots every day. The Omicron surge has tested and proven once again that vaccines and masks are our best tools to keep most people safe from each variant of COVID-19. Nevertheless, Omicron's high transmission rate caused more COVID hospitalizations than ever before, the vast majority unvaccinated. Our hospital systems and healthcare workers have battled to treat and to save not just COVID-19 patients, but every patient who walks through their doors. They've been working harder than ever before, and I hope that everyone listening will take a moment to express your gratitude to each of them. Over the last 2 years, I've said over and over that you don't know when a surge has reached its peak until you're on the other side of it. Today is our 7th day since we saw peak hospitalizations of 7,380 reported on January 13th. That's 1,145 more than the previous pandemic peak on November 21st. Since then, our single-day number of COVID patients in the hospital has fallen by over 870 patients. That's a decline of 11.8% since January 13th to 6,507 today. Over the same period, ICU and ventilator usage has started to decline, a welcome change after precipitous increases over the prior 7 weeks. I want to be clear, I am cautiously optimistic about this decline, but there are an awful lot of people still battling for their lives in hospitals across Illinois. With our ICU capacity at around 10% and 6,500 COVID patients overall in our hospitals, we're continuing to provide as much relief as possible to all of our patients, to our healthcare workers, and to our hospitals. We have lost so many people in recent weeks. Since the beginning of January alone, over 1,500 of our state's residents died from the virus. Despite the recent indications of fewer new infections and fewer new hospital admissions ahead, it breaks my heart to know that in the coming weeks, hundreds more may die among the thousands who are already seriously ill from COVID. Again, the vast majority of those are among the unvaccinated. That said, our declining hospitalizations rates are a hopeful sign that vaccinations, boosters, and masks are working. It's a sign to press on, to persevere, to keep going, so we will do that. Yesterday, we announced that more than 24 additional nurses, paramedics, and specialists were being deployed to Ingalls Memorial Hospital in Harvey, provided through the Federal Emergency Management Agency. That's on top of the previously announced federal deployment of healthcare staff to Rockford's Javon Bay Hospital. And of course, we have 1,870 surge staff and strike teams working now across Illinois, with hundreds more on the way. We are still very much in a period of immense strain for our healthcare systems, so we must do all that we can to keep our healthcare workers and institutions operating and available to all who may need medical assistance. You can help too. As I mentioned, the vast majority of Illinois COVID-19 hospitalizations are occurring among the unvaccinated. The most important thing that you can do right now is to wear a mask indoors when you're with others, to get vaccinated, and to get boosted. Some people who have heard this message before think that unvaccinated people have already made up their minds not to get vaccinated, so trying to convince them just won't work. Well, that's just not true. In the first 2 weeks of 2022, 14,000 new people have gotten their first vaccine dose every single day in Illinois. That's around 100,000 newly vaccinated people, about the population of Peoria, every week. People are still listening, and many who have remained on the fence for a while now are choosing now to get protected and to protect their children. So if you know someone who hasn't yet been vaccinated, approach them with compassion, with facts, and most of all, with your own reasons for getting vaccinated. You just might be the person that helps them decide that they should get protected. Thank you, and now I want to turn it over to our Director of the Department of Public Health, Dr. Ezike. Doctor.
Good afternoon, everyone. Please don't be mad. I just want to wish sincerest birthday wishes to an incredible boss and leader, Governor Pritzker. Happy birthday. As the governor said, I am cautiously optimistic in reporting the decreasing trends in the number of cases, in the number of emergency department visits, as well as the number of hospitalizations over the past week. Of course, we need these trends to continue. Everything is relative. While overall hospitalizations are increasing, both in the number of people that are going into the hospital with COVID every day, as well as the total number of people in the hospital with COVID, they are decreasing, but those numbers are still high. The numbers of people in the hospital with COVID are still higher now than they have been in any other surge or any other part of the pandemic. But the good news is that the trend is downward. The sheer volume, however, still is a problem. It's still a challenge to those workers, and we still have to pull every single lever available to help increase just the staff to care for those people in the hospitals. And yes, we have seen over the last month that the number of children in pediatric ICUs with COVID has increased. But at this time, there is not a COVID vaccine for our youngest ones, those 4 and under. But let's focus on what we do have, and that is that we have a vaccine for everyone 5 years and older, and that by being vaccinated, if you are in that eligible population, you can build that hedge of protection around those who are too young to be vaccinated for themselves. And the Illinois data shows that being vaccinated or only partially vaccinated as opposed to being boosted places you at 11 times greater risk of hospitalization and 13 times greater risk of dying. So you want to be on the side of the boosted. And as you also hopefully can tell, vaccination is not just about the individual who gets vaccinated. Yes, for sure, your risk of suffering severe illness and hospitalization does decrease dramatically when you're vaccinated and boosted. But being vaccinated and boosted also helps to protect others, like those 4 and under that we just talked about who can't be vaccinated at this time. Another way that we can protect others is to slow the transmission of this virus. And that's by knowing when you're actually infected. And so that might involve testing. A positive test will let you know that, yes, I need to stand down. I need to isolate so that I don't spread this virus to others. And then you can reach out to other people who maybe you were in close contact with before you knew that you were positive, so that they can quarantine, so that they can know when it's time for themselves to test. The U.S. Department of Health and Human Services is offering 4 free at-home COVID-19 tests to each household. All you have to do is go to covidtests.gov and fill out your address. HHS expects orders to ship out by the end of the month, and then they'll be delivered by the U.S. Postal Service. You are encouraged to order those tests so that you can have them when you actually need them. Again, we all need to vaccinate, boost, mask, test, and that will all be helpful as we get towards the end of this pandemic. And now I'll summarize comments in Spanish. Buenas tardes y feliz cumpleaños a nuestro gobernador, Governor Pritzker. Como ha dicho el gobernador, también soy cautamente optimista al informar tendencias a la baja en el número de nuevos casos, visitas a la sala de emergencias y hospitalizaciones durante la última semana. Sin embargo, necesitamos que estas tendencias continúen. Aunque las hospitalizaciones en general están disminuyendo, seguimos viendo un alto número de personas en el hospital con COVID-19. El volumen de personas en el hospital sigue siendo un desafío y seguimos jalando de todas las palancas disponibles para aumentar el número de empleados en los hospitales. Una tendencia preocupante que hemos observado en el último mes es que el número de niños en las unidades de cuidados intensivos pediátricos ha aumentado durante el último mes. En este momento, no existe una vacuna contra el COVID-19 para los más pequeños, los de 4 años o menos. Sin embargo, hay una vacuna disponible para todos los de 5 años o más. Y al estar vacunados, podemos construir un cápulo de protección alrededor de aquellos que son demasiado jóvenes. Los datos de Illinois muestran que estar vacunado o solo parcialmente vacunado, pero no con la refuerza, lo coloca en un riesgo 11 veces mayor de hospitalización y 13 veces mayor de muerte en comparación con aquellos que están reforzados. Pero la vacunación es más que usted solo. Sí, su riesgo de sufrir una enfermedad grave y hospitalización disminuye drásticamente cuando está vacunada y reforzado. Pero estar vacunado y reforzado también significa que estás pensando y protegiendo a los demás. Otra forma de proteger a los demás es ralentizar la propagación del virus haciéndose la prueba. Una prueba positiva le hará saber que debe aislarse para no contagiar el virus a otras personas y comunicarse con aquellas personas con las que estuvo en contacto cercano para que hagan la prueba también. El Departamento de Salud y Servicios Humanos en los Estados Unidos está ofreciendo cuatro pruebas caseras gratuitas de COVID-19. Todo lo que tiene que hacer es ir a covidtest.gov y completar su dirección. El Departamento de Salud y Servicios Humanos espera que los pedidos se envíen a finales de mes y serán entregados por el Servicio Postal en los Estados Unidos. Los recomendamos que pida las pruebas ahora para tenerlas cuando las necesite. La vacunación, el refuerzo, las máscaras y las pruebas ayudarán a poner fin a esta pandemia. Muchas gracias para su apoyo. And with that, I will turn it over to Governor Pritzker.
Thank you, Dr. Ezike. Happy to take questions. Craig?
Governor, happy birthday, by the way.
Thank you.
So, I'm going to ask you, and maybe this Chicago, she said, question, I'm not hearing that from either of you. You do not believe we happened.
No, I think what I said was that we've been 7 days since the peak. And it's always looking backward, just as Dr. Arwady sort of indicated in her remarks, that you can tell there was a peak and that you are falling from that peak. So I'm pleased to say that we have for 7 days now been dropping the number of people who are in the hospital for COVID, and as well we've seen a drop in the number of cases each day, although as I've indicated that's not exactly the indicator that tells me that we're past a peak. It's really hospitalization, ICU beds, and ventilators, and those all seem to be going the right direction. Dr. Zika, do you want to say anything more?
Governor Pritzker.
Yeah.
Got one from Block Club Chicago, Kelly Bauer, and three from myself. Will the state do anything to all sites closed or to review its testing practices in light of recent reports and the Minnesota Attorney General Office's lawsuit? Does the state have concerns that it was getting accurate results from the company's lab?
I mean, yes, deep concern, and of course the Attorney General is on it. The federal government, as you know, has been on this case as well. It's something that I expressed from the podium several weeks ago, the concern about what Block Club has reported, which is that there are, fly-by-night testing operations, and we need to make sure that we're keeping those away from people who are looking for legitimate tests, and if we can close them down, we will.
Dr. Zika Park.
No, of course, we all support people being able to go to a legitimate site where they can get answers and responses that they can act on that are actually correct. And so we support, obviously, any efforts to make sure we shut down and deal with those people who have been bad actors and have harmed the public health of the state with those bad actions.
One other for you, Doctor. Dr. Walensky said last week that the current surge in the country, which was up 40% last surge rather, was mostly coming from those deaths. There were 99 deaths reported in Chicago in the last hours. Do we have any sense of how?
No, it's a great question, but it's very hard to answer. We have to be clear that when someone goes into the hospital today, we don't know what exactly they have. I mean, as we get further along into Omicron, where there's nothing else in the state besides Omicron, and I think we are definitely in the high 80% of Omicron, if not 90 plus, we know as we go further that all the people who are getting infected are Omicron. But you have to remember that when people get infected to when they might actually die, that's not a day or 2 or 3. That can be 2 weeks, 3 weeks, 4 weeks. And so if you think about people that we are getting those reports today, and then you go back 4 weeks, some of those will be Omicron, but some of those will definitely be Delta, because we were not as predominant Omicron 4 weeks ago as clearly we are now. But again, we don't have that information for each patient.
Dr. Zika, of the 6,507 hospitalized in the state, how many are there for COVID and there?
Yeah, no, that's
We know that certain hospitals have been auditing and there's hospitals.
Yeah, so that's an important question, and we have been looking at that. That was the same, that's the same across the country. We're seeing that because of the ubiquitousness of Omicron, that there are people who maybe went in for hip surgery, but as you're going to intubate them, you definitely want the staff to be protected, and you need to know their status. And so they might have come in for the hip surgery, but then are found to have COVID, which is still significant because the special precautions that need to be taken for anyone who has COVID, the special PPE and garb that the staff have to wear, the special isolation, all of that has to take place. So we do need to know all those individuals. But it is true that there are some people who are not suffering many respiratory illnesses associated with that, but it's still important to know all those people. And there are people who now their course has been complicated, where maybe they came in for something that was not respiratory related to COVID, but the COVID then became an issue, i.e., someone who maybe just had a UTI, but now it's complicated by a pneumonia from the COVID, and now you're dealing with two things. So again, each case is different. Some, the COVID is an actual illness that needs specific attention. They all need attention in terms of how the caregivers will care for them and the special PPE, et cetera, and the isolation and where they can be placed vis-a-vis other patients.
I think I said boosters.
Okay.
Among those who are eligible for boosters, 55% have been boosted. Are we approaching anything
No, it's a great question. So on the books, so to speak, we have like 2.5 million people have been definitively identified as positive in our system. But we know, if we look at the number of home tests that were purchased just from retail pharmacies versus how many tests were done in our state, the actual number of home tests, which don't have to be reported, equal or match, actually slightly exceed the number of people that we have results for. So we know that there's a lot of undercounting. But I think that herd immunity, we have to kind of get away from that. When I think about, Australia is 90% vaccinated, and they don't have herd immunity. They still are having outbreaks. They're still seeing an uptick. So I think, unless herd immunity means 100%, we see that it's a very high number before you can get that protection that is supposed to be afforded by the herd. And in the meantime, if you try to use that as your only strategy, that results in a large number of additional deaths.
Governor, a two-part question. For determining what hospitals during this surge. Second part is, what does the state do for the next?
I'm going to ask Dr. Ezike because she gets the request.
Okay, those are two great questions. So for the first one regarding how does someone qualify, so actually every hospital can make the request to get that support from the federal government. Of course, the things that because some people get turned down, some people get accepted, the things that are critical are to show, the severe need, to show the severe staffing shortage, and to show that the hospital themselves have pulled every lever on their own, that they have suspended, unfortunately in many cases, have suspended non-emergent surgeries or, temporarily suspended them to the extent that they can, that they have used their contingency plans, their contingency standards to try to accommodate the staffing shortage. And then after they've, basically pulled on all these levers and say, we really need help, then there's still an assessment that is done by the feds, and then they can decide yay or nay in terms of if they will provide that support. The second question was,
It was about like what's the state variant,
Right.
So that we don't.
yeah, so I think the state is going to continue to do its part and has done its part in terms of preparation for the next. We have a surveillance system in place. We have genomic sequencing to look and see if we can see new sequences that are not relatable to any of the previous variants, so that we can report out to our neighbors and to the feds to say, hey, there might be something suspicious with this one. We've created an infrastructure that people can get vaccinated and boosted quite easily. I think the other part is on the actual people. And so people have to get themselves ready just as they would for any natural disaster. And that preparation involves getting boosted and staying fully up to date. Not, people who got that one dose just to get the one dose, like, you are not fully prepared for the next variant. You need to be within 5 months of your last shot. If you got a single J&J and you haven't gotten an mRNA second dose, and it's been 2 months since that J&J dose, you are not fully prepared. So we are doing a lot. We've set up the infrastructure. We have vaccines readily available for everyone. The other part is for the individuals to go and avail themselves of those resources to protect themselves and their family.
Governor Pritzker, since we last spoke, 2 new people are vying for your job. Mayor Aurora, Mayor Republican, and Eric Mancow-Muller is running in either of those candidates.
I don't know, they've got a messy primary over there on the Republican side. I'm sure they'll work all that out. I'm not sure about the independent. I know it's difficult to get on the ballot sometimes as an independent, but yeah, I don't really have any
And
opinions
then
about it.
yesterday, Mayor Light, Governor, are you going to do the same for her when she runs?
Well, I appreciate, I have not heard that. That's very kind of her. And yeah, I mean, I think, what I can say is there's nobody running, as far as I know, for mayor. And I think, the mayor has worked well with me, especially as we have addressed the pandemic broadly. And so, we have a good relationship, and, I know we'll keep working together to make sure we're keeping people safe and healthy.
You have time
I
for
do
one
want to
more-
say, if I
one
may,
more
I'm sorry,
question?
I just want to add one comment, though. You asked about candidates. One thing I will say to you is, if you want to have the job of being governor, you should have to take questions from members of the media, just like I do. And so I would hope that any candidate that is running and announce that they're going to run is going to take questions and not wait weeks after announcing to do so. Chris.
Dr. ZK, can we ask a question of you from CBS? The question is, this is moving so rapidly, compared to an ice pick. Up fast, it's coming down fast. As we are racing through this, what are you looking at as far as metrics to make any kind of changes or recommendations as far as policies in this state? A lot of people are hearing great news today, smiles on your face, which speak volumes. They're thinking maybe there's some change coming to my life. How quickly might change become the lives of people in Illinois?
I mean, we have ongoing discussions. We've been waiting for an opportunity to think about how we pivot to the next stages. And so as we come up with that between the IDPH team and the governor's office, we will absolutely share what plans we have to move forward in this pandemic. And yes, we are looking forward to sharing those. It's not today, but we are looking forward.
What data points will be the first ones that will say, aha, it's time?
So obviously, we are already seeing some of the things that we like to see in terms of downward trends in the hospitalization. Again, I am absolutely moving away from the cases because we know that that's not even the full story, given all the home tests and all the positives that are happening at home that are not recorded in any of our Department of Public Health databases. But the hospitalizations, you can't hide a hospitalization. And so as we look at those hospitalizations and understand where those numbers are going, that is definitely a clear signal of the direction we're moving in. And I mean, we can be moving downward now, but as, people have appropriately asked, but what about the next one? So, we want to just continue moving in that downward direction, but also, 2 years into the pandemic, we've learned so much, we've amassed so much knowledge, we have to figure out how we are going to live, how we are going to coexist with COVID. And so there may be some adjustments or shifts that we will make given the wide availability of vaccines and now the onboarding of therapeutics, which I think the quantities are very limited now, but as those increase, those are also a game changer that will allow us to maybe pivot from everything being COVID, and being able to have it as something that we coexist with.
All right, thank you, everyone. Thank you. Thank you all. Thank you. Thank you. We're good. Thank you.